Welcome to Mindcast, your 10-minute mental wellness break, brought to you by Sanitas BeWell. We're your BeWell counselors, here to talk about stress, anxiety, depression, and everyday mental health. Let's get into it.
Hello, everybody. I'm Genae Brady, and welcome to Mindcast. This is the BeWell podcast for Sanitas Medical Center. And today I have with me Dr. Diana Zambrana. And today our topic is going to be discussing menopause. Dr. Diana Zambrana, how are you doing? Welcome. Can you introduce yourself?
Yes, hello, my name is Diana Zambrana. I'm working in Sanitas Doral. I am primary care. So I am here for everybody. If you need my help, everything is here. I am here for you guys. Okay.
Thank you. Thank you. Very helpful. And like that you are very helpful and you're able to help us with many questions today. Doctor, our discussion is on menopause, and we have lots of questions, but we just want to go to do a few of them. Can you tell me at what age do most women start menopause?
The range in the ages that started the menopause is around 45, 55 years old, but in the middle is the 51 years old. Is very common at that time. And sometimes we have premature menopause, but that one is when this genetic or when something happens, hysterectomy for something disease they have the people, but are really 45 and 51, 55 and median is 51 years old.
Okay. And what are some of the symptoms that some of our patients experience when they start menopause?
When they start the menopause, the people, first one is a stop the menstruation and her menstruation period is disappear for 12 months. That is menopause. Really, when there is a stop the period for 12 months exactly. That way they started the menopause. And before is perimenopause. Okay, so the symptom is very individual, but the more common symptom is like irritability, mood change, hot flashes, mood swing, anxiety, and mood change, gain weight. Okay, that is the more symptom the patient is when they come to the consult, the visit. Say, oh my God, I don't feel very well. I feel my body is changed. Cognitive is changed to don't focus too well. That is the symptom, the more common symptom that people is called dry vagina, low libido, dry skin. It's so many symptoms that people experience with the menopause.
I do have some patients that when they say, oh, I'm going through menopause and this is what I'm going through, like you explained, they have anxiety, there's issues down there and things like that, and they feel very uncomfortable, they feel like not themselves. There's also this one symptoms where some women say they feel hot, then they feel very cold, and it happens at night sometimes, and they get very anxious and nervous about that. What is that?
Yes, that the problem is when the patient, with what the woman is going to the menopause, the neurotransmitter in the brain is gone down too, because the estrogen is working together to get very good balance in the chemical in the brain. When the menopause is come, everything is going to decrease. And serotonin and dopamine is working with the mood to the people, to the woman. So, and that imbalance is causing very irritability, anxiety, mood change. And really, the person when he's come to the visit, the doctor say, I don't know what happened with me. When they talk to you all the history about that, they say, I can sleep. And then I can work in the next day because I feel fatigued because all the time I was sweating at night. So that symptom, the people, and that happened, and then they say, I am depressed. I have anxiety because I don't know what happened with my body. So, and that's why and you need to study, sit down and explain that is the normal physiology in your body. And that is, the change is come, but we can help to you. And they is when they say, oh, okay, but what I have to do? And then you can start explaining that symptom, every change is going, but and then your body is accepted that change you have on this time. The only we need to work together.
I do agree. We have a lot of patients, especially some of my female patients, who are going through this, they will say they have anxiety, they have depression. Some even have this fear like my body is changing. We try to tell them this is normal. We had the earlier podcast about, being okay with aging and gracefully and things like that, and being okay with it. As my grandmother said, I'm turning into a butterfly. Or when she get hot or cold, she's like, I was just too hot back then. It's just catching up. So, we tell them, it's okay. You don't be nervous. This is a natural change. You're going into a different, how I like to explain it to patients, you're moving into a different segment of life. You're starting a new journey in life where some of these things you may not have to have anymore. You may not have to have the periods or things like that anymore. So you're going into a new segment of life where you can do different things,
Yes, exactly. That is correct. You are very right. Because when you have the patient in the front, and I try to explain to her, don't worry, everything is be fine. But we need to work together. Because all the time they say, I need to you do my hormone panel. I say, okay, we can do, but let me do assessment. Let me do so many questions for you, and then we can see what is the best option you have.
And I have to remind patients, this is your control center. It's your brain, hormones and everything about you that makes you the most wonderful person that you are. Your body is connected to that, and it controls everything.
It's exactly I explained to my patient, and the other concept for there is the low libido. Oh my God, my husband want killing me. Don't worry, bring to my husband. I can explain to him too. That's normal for you. Yeah.
Absolutely. When you talk with your partner about these symptoms you're having, and you're open and say, I'm going through this change, and who knows, your husband might be going through a change too. Your partner might be they might be saying, I've been going through changes too. Something's happening with me too.
This is true.
What's happening with you? Let's compare. Let's go to the doctor together.
Yes, it's true. Yes, it's true. Yeah.
That's healthy. That's normal aging. That's a normal process and things like that. And even sometimes you have the support of your husband or your spouse. They will actually start doing these things they'll start yoga with you. They'll start eating right with you. They'll start exercising. You have a support system now. You guys can get healthy together. So these are some good things to help people stay healthy, as we're moving in the next section of life. Yeah.
Yes, this is true. Yes, I think the mental health symptom during the menopause is very common. Usually, it's very manageable and often improve when we have correct or the right communication of the medical care, lifestyle change, and emotional support is so important with them, with the patient, because they need the emotional support at that time.
You're still you. It hasn't changed you in any way. You are still the wonderful person that you are. So our program does offer lots of treatments for this type of issue and this type of thing that naturally occurs,
Okay.
and for women. And we offer also mental health services for when you're feeling those anxieties and that depression, and you have those worries and things like that.
Yes, when the symptom is severe, we can do the treatment. But when it's not too severe, I am agree with you. It's very do the session behavior and the emotional support. Talk about it. What happened? What do you do? What we can do? If you feel something, you can do this. You can do this. Do please starting exercise because we can gain weight too. So that is the only instruction I give it to my patient really all the time when they come with that topic with me.
Thank you, Dr. Diana. So this was excellent. I would love to have you back on again and talk more about this and other things about women's health, especially. But I'm glad that you came. And if you or anybody else out there is suffering from menopause, or you have anxiety or depression symptoms, or you're going through something, or you notice your partner is going through something, you feel a little bit down or depressed or anxious about it, please call Sanitas. We have excellent doctors like Dr. Zambrana, and we have excellent counselors like myself and the rest of the counselors with the BeWell program. Please call us, reach out to us, get an appointment. Don't sit there and wait. Get an appointment. It's much better if you get the help.
We're working together.
Exactly. Collaborative care. That's what it is.
Yes, of course.
Thank you, Dr. Zambrana. It was great to have you.
You're welcome anytime.
All
Thank
right.
you.
Bye-bye.
Bye-bye.